The stark reality, the stark economic reality of the American healthcare system, which is what needs to change if we're going to actually improve the outcomes of America. But the stark economic reality is that every institution that touches our health, from hospitals to clinics to pharma, even to insurance companies, will make more money if you are sick and less money if you are healthy. And so chronic diseases, these isolated chronic diseases like what my mom had, diabetes, high cholesterol, high blood pressure, the system profits off treating those as separate things that you do things to for long periods of time, chronic disease management. So not actually healing it, but managing it. And so because that's built into the deep finances of the largest and fastest growing industry in the United States, which is the healthcare industry, there is no incentive for people to back up and look at all of the things going on and say, wait a minute, maybe we're looking at this wrong. Maybe there's something more fundamental, the trunk of the tree leading to all of this. Maybe we could just intervene there and a lot of this stuff would melt away. And that is the reality biologically. But because of the trillions and trillions of dollars that are baked into the way the system operates right now, no one has any real incentive to stop and to do that. And so the pieces actually get actively held apart. If you think about going to the doctor, how often if you have several specialists you're working with, how often are they talking to each other? Never. Usually the health records are in different systems and it's almost impossible to even have one doctor see the notes of another doctor from another specialty. It's literally baked in on every level, the separation, which is not serving patients, it's serving the financial interests of a reactive sick care system that is fee for service.
After your mom was diagnosed, what did the doctors recommend?
So this was what was so funny, was that the second she got the stage 4 pancreatic cancer diagnosis, it was like full court press from so many different doctors. They wanted a hematologist to help her because her blood counts were low. The cancer was sort of causing her to destroy her red blood cells. There was radiation oncologists, surgical oncologists, medical oncologists, radiation, surgery, medication. There was a liver doctor who wanted to put a stent in, and everyone was talking, and it was incredible how much of a flurry it was. And, we all kind of looked at each other and thought, wow, 40 years of symptoms that we kind of know are all connected. And not once was there like a flurry of activity to like truly get my mom healthy, to truly get her cells to heal. But the second there was this big diagnosis, very late stage, everyone flies into motion. And what was interesting is that the diagnosis was so bad. Pancreatic cancer outcomes are so bad. And my mom was so in touch with her body and her really spiritual knowing that she knew like this was very bad. And she had this sense that it was going to be fast. So we actually declined all the crazy amount of interventions they wanted to do and went home. And she was able to die peacefully at home, 13 days later. Everything they recommended, nothing would have even basically had any time to have an effect before she died. None of it would have been worthwhile.
You said that there was in your article, you said there was a 33% chance that it would extend her life just a little bit.
Just a little bit.
And then 33% chance that it would do nothing. 33% chance that it would actually kill her, that the remedies, so-called, would actually kill her and curtail her life even more. And so even if you took that 66% chance that she could live a little bit longer or that it would do nothing, she would still possibly, if she took those routes that the doctors were recommending, because this was COVID era, she would have been dying in a hospital alone by herself. She would have been going to these procedures by herself. And you all knew that that's just not the end that you wanted for her. That's not what she wanted.
Yeah. And those numbers that they gave us didn't even take into account the additional complications she had. When she showed up at the hospital, the diagnosis, she was in liver failure because of the metastases in the liver, and her blood cells were depleted. So I think even that 66% of maybe having a benefit was so overblown. And so we looked at all this, and and said, no, like, we don't want to give my mom up to the hospital, where she would have almost unquestionably generated what, $500,000 plus of revenue for that hospital, and had to die alone in a COVID lockdown unit. So we asked questions, and they, of course, were super shaming to us about, not doing the internet, just that it's irresponsible. Literally, the liver doctor, if this was my mother, I would absolutely have her in there for that liver stint. I mean, she's in fulminant liver failure. She can barely, this is a few days after the diagnosis, she was getting worse really quickly. She was feeling super weak, and they were saying, you got to get her in here. And, it's just so wild if you think that people who might not have the confidence or the background in medicine to ask some of the deeper questions. I think probably 95% of people would just kind of go with whatever the doctors said. Again, they're like the best doctors in the world. And it would have done nothing but hurt her. And that's not to say that people shouldn't take the intensive route, but we absolutely should be asking questions. And I think the system, one of the ways it's become so damaging, especially more recently, is that the system has really create an environment where people, I think, struggle to ask questions. We've been told, you think about the last 5 years, plastered on billboards practically, trust the science.
Yeah.
Trust your doctor. And what's so alarming to me, and again, one of the reasons why we wrote this book, is that the system, when it comes to chronic health issues, has really done very little to earn our trust. As we've started medicalizing these chronic diseases, which are primarily based in diet and lifestyle, and many of which didn't even exist 75 years ago. At the same time we've been asked to trust the science, these diseases have exploded in their rates and are going up every single year as we spend more money on them. So what I think the healthcare system has done, I mean, it has produced miracles, of course. Life expectancy has gone up in the last 100 years. But what our healthcare system has done well at is acute issues, things that are immediately going to kill you, like an infection or a trauma surgery or something like that you need to have. So acute issues. And that's primarily treating those, which are like the patient comes in, they get treated, they're gone. Those, I think the healthcare system does a miraculous job at. But what the healthcare system has done has asked to take our trust on its success in acute issues and apply it to chronic issues, issues that last for a long time, that need to be treated for life. If you think about an acute patient, that's not recurring revenue, but a chronically ill patient is recurring revenue for decades. And so essentially the system is asking us to not ask questions and to trust blindly because of the trust they engendered from acute issues, apply it to chronic, where they're abjectly failing at keeping us safe. They're not preventing these conditions. They're certainly not reversing these conditions. They're just managing them. And the message that I really want people to understand is that it's actually much less complex than we think to really improve our foundational metabolic health, to improve really the way our cells function, and to really generate true health in our bodies. But we've got to focus on the right issue, which is helping to clean up the environment that our bodies and our cells are living in right now that are breaking them. And when we do that, and we really do truly heal the foundational pathways of our body related to metabolism and cellular health, we end up getting just incredible health across all these different systems. But unfortunately right now, that's not what the system's going to help you with. Their revenue model is based on more patients going through the system as quickly as possible, which lends itself to going in, getting a prescription, and leaving.